Being at work can be good for mental health, but the increasing pressures of work can be stressful. A difficult work environment or ongoing work-related stresses can worsen the mental health of employees. In some circumstances, they may take their own lives. But suicide is never the answer. There is always hope. Employers and managers have an important role to play in looking out for the mental health of their staff. They can help create a culture where people feel safe to talk about their mental health and to seek help.
Hello everyone, my name is Nurfatiha binti Jamaluddin. My matrix number is 20247362995, and today I will present about the role of leadership in prevent burnout during change initiative in the healthcare based on the article by Kimberly Longholt 2025. Firstly, burnout happens when healthcare workers, especially in emergency and also critical care units, face high stress. As a result, this can cause tiredness, emotional detachment, and also loss of motivation. Moreover, when new systems or policies are introduced, stress often increases because staff have to learn new ways of working while still caring for other patients. Importantly, burnout is not caused by personal weakness. Instead, it usually comes from the poor leaderships, weak cultures, and also unclear rules. Interestingly, the study also shows that staff with fair, kind, and also supportive leaders are more engaged, mentally stronger, and also less likely to experience the burnout. There are several main causes of the burnout during change initiative. Firstly, increased workload is a major factor. Nurses often handle too many patients and a lot of paperwork. Furthermore, when new systems or policies are added, the workloads become heavier. For example, nurse in emergency units report feeling very tired and also overwhelmed when patient numbers and paperwork increase at the same time. Secondly, poor communication and lack of support contribute to the burnout. Leaders who listen, communicate clearly, and show care can reduce the stress. However, poor communication can cause mistrust, loneliness, and also dissatisfaction. For instance, an ICU nurse said that regular check-ins by the supervisors help manage daily stress, showing how the supportive communication matters. Thirdly, toxic workplace culture can worsen the burnout. On the other hand, positive culture and also teamwork help workers to cope. For example, a doctor said working in supportive teams reduced stress, while negative workplace left them emotionally drained. Finally, a weak implementation of wellness policy is another cause. Many hospitals have wellness program and mental health policy, but they are not fully applied. As a result, staff feel unsupported. Wellness program will only if applied and also monitored consistently. As a result, burnout affects both employees and also the organization. Mentally, it causes anxiety, depression, and also fatigue. In terms of work, it reduces the motivation, focus, and quality of the patient care. Additionally, high stress leads to the staff leaving jobs, which creates shortages and also lowers the healthcare quality. Lastly, decline in service quality. In healthcare, burnout affects patient safety and also care standards. So, to conclude, the article note that emotionally drained workers made more mistakes and show less readiness for the new organizational procedures. How leaders can overcome this problem? Leaders play a key role in reducing the burnout. Firstly, they should be empathetic, ethical, and fair, showing care and honesty, and treating everyone equally. For example, a manager noticed a nurse struggling with her task and redistributes the workload, showing care and also fairness. Secondly, they should communicate clearly and regularly, keeping staff informed and listening to their concerns. For example, during a new system rollout, the supervisors explain steps and holds weekly check-ins, reducing uncertainty of the staff. Moreover, they should encourage teamwork and recognition, building a supportive culture where people feel valued. Finally, leaders should apply wellness policy consistently so the programs actually help the staff. Mental health workshops are offered during work hours, ensuring the staff can participate. Lastly, a leader who checks in with staff, listens to the challenges, and also adjusts the workloads when possible can significantly reduce stress and also improve the motivation. To conclude, burnout during change initiative happens because of the systematic problems, not individual weakness. The main causes include heavy workload, poor communication, toxic cultures, and also weak policies. Therefore, organizations need strong and supportive leadership, clear communication, healthy workplace culture, and consistent wellness policies. In summary, when leaders are kind, fair, and transparent, employees feel valued and motivated. Supporting staff well-being not only helps employees, but also improve the patient care and also strengthen the healthcare system. Thank you for listening. Bye. Assalamualaikum.